Now, when it comes to creating a temporary treatment order, the authorised psychiatrist must examine the person to determine whether they meet the criteria and require compulsory treatment. If so, the temporary treatment order will be made. This examination needs to happen before the assessment order expires and cannot be made by the same person who did the assessment order. It is also important the psychiatrist considers the person's views, treatment preferences, and recovery outcomes, as the Mental Health Act 2014 places an emphasis on recovery-oriented practice and placing the consumer at the centre of decision-making about their treatment. Also, if the person has a nominated person or guardian or a carer, this person's views must also be considered. For those under 16 years of age, a parent's views must also be considered. If during the 28 days of the order, the patient no longer meets the criteria, the psychiatrist must revoke the order and the patient is no longer a compulsory patient. However, if this is not the case, the patient will have a hearing with the Mental Health Tribunal before the expiry of the 28-day period to decide whether further compulsory treatment is required. An important thing to remember as a nurse is that a temporary treatment order is not valid unless the following requirements are met. 1. The order specifies whether it is a community or inpatient treatment order, states the date and time it was made, and states the order has a duration of 28 days unless revoked at an earlier date.